Hello, welcome to The Public's Health, the show that puts the public back into public health. I'm Dr. Muntu Davis, Deputy Health Officer for Alameda County's Public Health Department. Today we'll take the opportunity to take a look back at the first 9 shows that we did. Then we'll take a look to the future at an important future project. Dr. Iton, our regular host, couldn't be here today, but he wanted to send his greetings and remind you of our goal. Our goal is to provide public health information to you, the public viewer, in an enjoyable way. We also like to have an open dialogue with the public, so we incorporate on-the-street personal interviews. We also have taken a look at key subjects in public health. We looked at our response to Katrina, bird flu, seasonal flu, hypertension, diabetes, and much more. Take a look at shows 1 through 5.
A production of the Alameda County Public Health Department. This is a new show designed to invite you, the public, into the workings and doings of your public health department. I'm Dr. Tony Iton, the Alameda County Public Health Officer. With me today on our inaugural show.
I've done many things in my life, high school principal, run a business, been a family therapist, been on the faculty of various universities. And I found home in public health because it's about keeping folk healthy, working with the community.
And I didn't understand that because we was there and they seed us, and why would they circle and why would they wouldn't come down to help us. And I feel or believe if they would have came like they were supposed to and come got the people, because we was hollering help, I said, and then it wouldn't been so many drowning people.
We had some of our nurses and other folk go down to the south to help in that disaster.
We had no idea what was wrong with her medically, no idea what medication she had been taking, where she had been treated, or anything.
I didn't know the name of the medicine.
We're joined now by 2 nurses from the Alameda County Public Health Department, Larry Vitale and Albert Pappalardo, both of whom were sent by the Public Health Department to respond to the disaster in Katrina by working with their brothers and sisters on the front lines in hospitals.
If they say that there's a hurricane on the way, leave as far as you can go. Don't even stay in Louisiana. Leave.
If I'm exposed to influenza, how long does it take for me to actually start to get sick?
Yep, it's about 1 to 4 days between the time a person's exposed to the virus via these respiratory droplets, as we talked about, until they then start to show these symptoms that we've talked about, fever and the aches and just feeling tired and ill.
What happens is once all the donations come in, the money is divided up between immunizations and Mastic Senior Center, and we usually use that money to purchase vaccines for the elderly for next year. It's very important for seniors to get their flu vaccine because every year in this country, 36,000 people die from the flu.
We're going to move to the subject of avian influenza, which is something that has been on the minds of a lot of people lately, and we want to hear what the people on the street have been hearing.
I've never heard anything about a bird flu.
I've heard a little bit.
I heard a little bit on the news.
I know it's given off from some type of bird.
Sounds like it's still within the bird population and hasn't really mutated to anything that could be spread quickly to people.
And then when those conditions are met, brand new virus, nobody's immune, and it's transmissible person to person, then and only then can it become and be called pandemic.
Migratory birds are spreading this into new countries every week, every month, but still not really a human illness.
Until we identify a virus that is readily transmissible person to person, it would be very, very difficult to make a vaccine that would work.
What are counties doing to prepare?
Education of population, education of healthcare providers, increased surveillance, and planning to deliver either vaccine when it becomes available or antiviral meds if, in fact, they too are available.
That's great.
Drugs and alcohol are almost never a good idea for mentally ill patients. One problem that a lot of mentally ill people have is a problem controlling their impulses. And most of the drugs that people will take, that is not medication, but drugs, will make it more difficult for people to control their impulses. The same is true with alcohol. So it's not a good idea to be drinking or taking drugs, especially at a time when they might be under emotional stress.
Anxiety, too much anxiety.
It works out okay. I don't get too stressed personally.
A lot of times when I work with depressed clients, they will say things like, well, you know, I called somebody, they didn't call me back, maybe something's wrong. You know, you don't have the ability to think logically that, well, maybe that person's on vacation, maybe they're busy, maybe they're stressed out.
This recipe that I'm preparing today just calls for the sweet potato, apple juice, and cinnamon. That's it, just 3 ingredients.
That sounds simple, but
Yeah.
Making it healthier, does it change the taste?
Well, I want you to see for yourself. But let me show you first how to prepare the apple glazed sweet potatoes.
That's good.
It's delicious.
You can taste the cinnamon in there too.
Yeah, very good. Yeah.
Very good.
Hope you enjoy the show. I encourage you to stay active and eat healthy.
I used to eat it like a lot, but now, like after I watch Super Size Me and all this other stuff, it's telling me biology, all the classes, probably like maybe once.
Not being able to be that athletic and not being able to be on teams, sport teams and stuff.
It could be hard just to go up a flight of stairs.
But the worst part about it though is like you be embarrassed to, you know, go in the swimming pool and come out with your bathing suit.
I don't really exercise, I just walk. I don't even take gym, but I coach basketball and stuff. And it's like little stuff, like don't eat all the junk food. Instead of taking the elevator or the escalator, take the stairs, walk, and all this stuff. So, I mean, you just do that stuff. But as far as exercising, like going to the gym, no time for it.
Did you know that only 32% of kids in Alameda County get enough physical activity and are fit? And did you know that only 44% of kids get the required 5 servings of fruits and vegetables a day in California?
Doof is a new 13-part television series that addresses issues of nutrition and obesity by entertaining, educating, and engaging children in the story of food from source to table.
A lot of the problems we're talking about are as a result of kids watching television and too much television, so you would think a TV show isn't the best place to address it. The thing is that they're getting the wrong information about food from fast food ads.
And we're going to do some yoga poses, simple and easy poses that are accessible to everybody.
Well, Student Run Oakland, for someone who's never heard of it, best description is that it was a few volunteers who with good intentions and wanted to help at-risk or disadvantaged students, give them opportunity that they don't ordinarily have.
Every patient ought to know what his blood pressure is, because if you keep it normal, you don't have to worry about heart disease or heart attack, because if your blood pressure is normal, you're unlikely to have it. And you shouldn't have to worry about stroke, because you're unlikely to have it.
I have been told I had 2 mini strokes. That means my hand numb and my mouth was feeling numb.
It has something to do with the distribution of is it insulin?
Low insulin.
Glucose, high glucose, too much.
There's actually several types of diabetes, but the main one.
Well, we covered a lot in those first 5 shows. I hope you picked up some tips on the physical activity as well as good nutrition habits. Now let's take a look at the next 6, let's take a look at shows 6 through 9, where we have an esteemed panel of guests discuss violence prevention in West Oakland, as well as other experts talk about asthma, adolescent health, perinatal abuse, and much more. Let's take a look.
We have a wonderful panel and a complicated topic that we're going to try to address systematically if we can. We have some of the county's foremost experts in violence prevention with us today. Arnold Perkins, Alameda County Public Health Director. Violence? Is this a public health problem?
Absolutely. Public health is about health. It's also about disease. It's about prevention. It's also about outbreaks. We've had an outbreak of violence within our community.
Like Arnold, I was born in West Oakland, so around the time he came, I remember West Oakland as a very vibrant community when Clemens High School was nationally known and acclaimed.
Many of our young people who are unfortunately committing acts of violence are products of their environment. When you grow up in a destructive, devastated environment, you're often going to display destructive behavior. So when you grow up in many inner cities around the country, particularly West Oakland, is an environment of blight, poverty, high unemployment, low quality schools, substandard schools, and you have a liquor store on nearly every corner. You have illegal drugs readily available. You have guns easily accessible. When this is your environment, destructive behavior is going to be the outcome.
What has to be done is to get the families together and start paying attention to their offspring. So I really am an advocate for people to stay home, somebody stay home, take care of the kids when they get home from school. So, otherwise, don't have kids. You get somebody that's working and taking care of their kids and trying to do it right there. They're class act as far as I'm concerned. They're doing the right thing. A parent training. Any idiot can make a kid, but not anybody can be a father.
When you have a community that's really devastated, we need sincere investment in families. We need investment in schools. The education system in Oakland is horrendous. And there is a school-to-prison pipeline that's being built that the #1 indicator of future incarceration is poor academic performance.
These communities don't look the way they do out of nowhere. It's governmental policies. I often say 80% of the problem in community is government, not people. They do to community as opposed to with community, and we need to make a change.
With a lot of people involved in our community groups, they're starting to see that there's something that I have to contribute as a community member, as a citizen of Oakland, that is much more than me going to a meeting.
And that's the role that we play in public health, is to encourage people to take hold in their community, to reach out to your neighbor next door, because it's those folk who live in the West Oakland community that will change things, not law enforcement, not public health.
Well, West Oakland has a disproportionate number of abandoned buildings, liquor stores, rundown houses, junkyards next to rundown houses. You can just see from the master planning that has gone in West Oakland that there's been no real plan at all.
Many of these young people grow up in a culture of death. The music they hear on the radio perpetuates some of the most horrible behavior. The videos that they see, they're in class where teachers, they're in the back watching their PSPs and watching music videos instead of in school. And so these failing systems and the devastation of the community has led to the delinquent behavior.
I would beg each and every adult to become a mentor to a young person somewhere. Because what the studies show is when young people are connected to a positive adult person, they make a change in themselves. So you can make a direct change in somebody's life today by just being a mentor. That would be the #1 thing on my list.
We're going to talk a little bit about the broader topic of adolescent health and see from our community what's going on that's creative around getting youth and adolescents involved in their own health and taking ownership of that.
This is the Berkeley High School Health and Wellness Fair. It's hosted by a lot of different groups from all over the Bay Area. Anybody who has to do with health and wellness. My group, Passion, has 2 booths, one for sexual health and one for drunk driving. So it's a really big fair that we have at Berkeley High School every year.
And in the late 80s, early 90s, the science became much more sophisticated, and we really now understand asthma as a disease of inflammation. That is the main thing that's going on. Like so many diseases, it starts with inflammation. And this inflammation not only clogs up the breathing tubes, but actually makes these muscles on the outside of the breathing tubes very sensitive. So just a small trigger might cause these muscles to squeeze down. So really asthma is two things. It's inflammation on the inside of the breathing tubes, and it's the muscles that then squeeze down and make it hard to breathe.
Asthma as a disease is on the rise. We know, for example, that self-reported prevalence of asthma, sort of how common the disease is, has increased by about 76% just over the past 20 years or so.
There's two main kinds of medication, one that treats the immediate symptoms and one that prevents the asthma attacks and helps to get it under control. So I go over the different warning signs for the families to look for, the symptoms that a child might have, so they'll know when to give the various medications.
We used to manage the symptoms of asthma, and now we know how to prevent asthma. The problem with the new way of doing things is that in order to prevent asthma, we really need our families who have children or they have asthma themselves for adults to take medicines every day, even when they feel well.
I have asthma, and two of our three guests also have asthma. And one of the things we know is that in certain communities, particularly low-income communities with lots of African Americans in particular, and Latinos, the rates of asthma can be astoundingly high.
There's a lot of work happening at the state level, but also here in the Bay Area, to decrease, for example, emissions from diesel buses or from trucks that visit the port. Margaret will have a lot to say about that.
We are inundated within West Oakland by diesel. And by having diesel, as I have learned over the years, that diesel can trigger asthma attack. And so being that close proximity to that kind of activity of the port, community is just accessible to that poor outdoor air quality.
Wow, the Port of Oakland is the fourth biggest port in the country, and 12 to 14,000 truck trips a day. That's astounding.
So people need to either have to be educated around the use of having better indoor air quality, or being able to buy those devices that support that to better have better indoor air quality, or we have to address all the housing stock in West Oakland has to be much better so that you do have a better quality of air inside.
A project was proposed designed to increase preparedness among vulnerable groups like seniors, the poor, and people living with disabilities. We realized the Irvington neighborhood in Fremont had this kind of vulnerable population. This led to the creation of the Irvington Neighborhood Emergency Preparedness Project. We decided to launch the project with a preparedness survey.
Our community partners included the City of Fremont's Fire Department, the Fremont Family Resource Center, the Irvington Neighborhood Network, and many other community-based organizations.
In our diverse community, finding a sufficient number of bilingual speakers is sometimes a problem. Not so on the Irvington survey.
This is the Rough and Ready drill. It's taking place in the city of Fremont. And this is in conjunction with a state exercise which is called Rough and Ready.
So the scenario here is that we're responding to a anthrax attack that has occurred in the city of Fremont, and potentially the entire city of Fremont, which is a population of 210,000 people, have been exposed to anthrax.
A mass dispensing exercise is a role play of going through dispensing medicines emergently to a population in the event of a public health emergency or a public health threat.
I'm staying in a program called Project Pride. It's in Oakland. And I was in jail, and I got there from jail. And also I just had a baby, which was detoxamethadone.
So tell us a little bit about what life was like when you were actively using.
Well, I was still pregnant at the time. I was doing a lot of drugs. I was out there prostituting at the time, just doing a lot of drugs. And it was just miserable. I just should have been, I just didn't feel like I was alive anymore. My hopes and dreams are for me to continue being a good mother to my daughter.
Many of the issues addressed by the Public Health Department are dynamic ones. Research continues, microorganisms evolve and change, and treatments also change. One such topic is avian flu and its possible relationship to a pandemic flu. Watch the Public Health Show. You'll see in the next few months, 4 episodes on pandemic flu preparedness. You want to watch these shows to see what you need to do in order to be prepared. Also, you want to take a look at the websites for more information at the end. Let's take a look.
do first before business continuity can even get started? Well, the first thing about a lot of other
That's our show. I hope you've enjoyed our look back. And we want you to stay tuned for next time's show with Dr. Tony Iton, which will be the first of 4 episodes on pandemic flu preparedness. Thank you for joining us, and we'll see you next time.